Periodontology or periodontics is the specialty of dentistry that studies supporting structures of teeth, as well as diseases and conditions that affect them. The supporting tissues are known as the periodontium, which includes the gingiva, alveolar bone, cementum, and the periodontal ligament. A professional who practices this specialty field of dentistry is known as a periodontist. Periodontal diseases. Periodontal diseases take on many different forms but are usually a result of a coalescence of bacterial plaque biofilm accumulation of the red complex bacteria of the gingiva and teeth, combined with host immunoinflammatory mechanisms and other risk factors which lead to destruction of the supporting bone around natural teeth. Untreated, these diseases lead to alveolar bone loss and tooth loss and, to date, continue to be the leading cause of tooth loss in adults. Periimplantitis. Periodontology also involves the placement and maintenance of dental implants, including the treatment of periimplantitis, which is inflammatory bone loss around dental implants. The etiology of periimplantitis is thought to be very similar to periodontal disease. Training. Before applying to any postgraduate training program in periodontology, one must first complete a dental degree. Europe. Although each European state has its own independent system, an umbrella organization, the European Federation of Periodontology, has the ability to accredit postgraduate programs according to specific guidelines. The EFP awards a certificate of specialized training in periodontology, periodontics and implant dentistry to every successful European candidates after 3 years of full-time training in an accredited postgraduate program. The graduate programs that have been approved are the following: Academic Center for Dentistry Amsterdam, NL, University of Bern, Sahlgrenska University Hospital, Institute for Postgraduate Dental Education JAR paragraph NKA paragraph Ping, UCL Eastman Dental Institute, Universiteit Copyright Catholique de Leuven, University Complutense in Madrid, the Hebrew University of Jerusalem in Israel, the Technion in Haifa in Israel, University of Dublin, Trinity College, University of Strasbourg in France, Paris Diderot University at Rothschild Hospital. Australia. Australian programs are accredited by the Australian Dental Council and are 3 years in length and culminate with either a master degree or a Doctor of Clinical Dentistry degree. Fellowship can then be obtained with the Royal Australasian College of Dental Surgeons, FRACDS. Canada. Canadian programs are accredited by the and are a minimum of 3 years in length and usually culminate with a master degree. Graduates are then eligible to sit for the fellowship exams with the Royal College of Dentists of Canada. India. Periodontics is offered as a specialization field of dentistry in India. Periodontists attend a Master of Dental Surgery program affiliated with dental schools in India. The minimum qualification required for the MDS degree is a Bachelor of Dental Surgery degree. United Kingdom. The British Society of Periodontology exists to promote the art and science of periodontology. Their membership includes specialist practitioners, periodontists, general dentists, consultants and trainees in restorative dentistry, clinical academics, dental hygienists and therapists, specialist trainees in periodontology and many others. Specialist training in periodontics in the UK is either a 3-year full-time or 4 years at 3 days per week. At the end of the training, candidates are awarded a Master of Clinical Dentistry before being entered on the specialist list held by the General Dental Council. USA. The American Dental Association accredited programs are a minimum of 3 years in length. According to the American Academy of Periodontology, U.S.-trained periodontists are specialists in the prevention, diagnosis and treatment of periodontal diseases and oral inflammation, and in the placement and maintenance of dental implants. Many periodontists also diagnose and treat oral pathology, and periodontics was the historical basis for the specialty of oral medicine. Following successful completion of postgraduate training, a periodontist becomes board eligible for the American Board of Periodontology examination. Successful completion of board certification results in diplomate status in the American Board of Periodontology. See also: chronic periodontitis, dental implant, gum graft, Gum recession, Journal of Periodontology, Periodontitis, Scaling and Root Planing, References. External links, American Academy of Periodontology's article on periodontal disease, the National Institute of Craniofacial Research's article on periodontal disease, AAP Directory of Periodontists, Canadian Academy Directory of Periodontists, Dental Council of India, British Society of Periodontology, South African Society for Periodontology, European Federation of Periodontology.